This lecture will cover the infections of the urinary and reproductive system. So just to kind of review, the urinary system contains 2 kidneys, 2 ureters, a bladder, and a urethra. And so with the urinary system, due to the anatomical differences between male and female, UTIs tend to be more prevalent in women. And this is most likely or most prominently due to the urethra being so close to the anal opening. And it's also shorter. With men, sometimes benign prostatic hypertrophy and prostasis can constrict the urethra, which can increase the risk of UTIs. So within the urinary system, some of the different type infections include urogenital infections, in which the infections and disorders may jointly affect the urinary and reproductive systems. So you can have both systems, urinary and genital systems, that are infected. You have sexually transmitted infections, which are urogenital infections, but it includes diverse agents that are transmitted sexually. And then your urinary microbiome. This can vary significantly from person to person due to age, sex, the general health of the individual, and it can differ based on part of the urinary system. So depending on what the patient has as far as their normal flora, it can be affected by different things. Antibiotic use, exposure, things like that. But here's just a list of several organisms that can be found normally within the urinary tract. But studies have also shown that the urinary microbiome can shift, which can also cause infections to take place. With the female reproductive system, the vaginal area usually can help eliminate infections because of the epithelial cells that are constantly shed, as well as the vaginal mucosal mucus has an antimicrobial type property. And then the epithelium also releases glycogen, which can be metabolized by certain bacteria, some of the normal bacteria. The lactic acid producing bacteria, and so they're able to metabolize it, which kind of helps with the pH. So there are several normal flora that reside in the female reproductive system, but it's usually dominated by the lactobacillus organisms, and they do produce lactic acid, which causes the lower pH, which kind of inhibits some of the microorganisms from growing. And what we typically see is antibiotic therapies can trigger this to become imbalanced, where the lactobacillus can be killed off, which allows an increase in the vaginal pH because you don't have that breakdown to produce the lactic acid to keep that pH low. And then this will allow opportunistic type infections to happen. And more specifically, some of the ones that you might be more commonly familiar with would be the candida or yeast infection. There are organisms that will cross the placenta, and so these are referred to as the torch agents. And so the placenta is a barrier that helps protect the developing fetus, but it is not a universal barrier. So there are a number of pathogens that can cross the placenta and affect the fetus. And this can lead to complications like stillbirth, various congenital defects, spontaneous abortions. And so your torch pathogens are vertically transmitted to the fetus. So this will happen from mom to fetus, and it can, cross over that placenta barrier, just depending on what the particular organism is. But here's a list of those organisms that are known to cause issues with a developing fetus. And so with preterm labor, it can begin around 37 weeks, before 37 weeks of gestation. And at least 40% of preterm deliveries are associated with some sort of intrauterine infection. And so that's a pretty high number, considering how well the body does at taking care of some of these organisms. But as you do know, some of these organisms can be an opportunistic type infection, so it can cause some of these infections to pass from mom to fetus. And so it can be decreased, can be caused by a decrease in lactobacillus levels, which can causes that increase in pH due to the lactobacillus not being present and maintaining that low pH, which allows other organisms like Gardnerella and Uroplasma to develop, and things like Burkholder as well. With the male reproductive system, there are some normal flora that reside in the male reproductive system that helps to kind of keep all of that balanced as well and prevent any sort of opportunistic type infections. So urinary tract infections can be divided into upper and lower UTIs. And so with UTIs, they're usually caused by bacteria, although we can see funguses and viruses as a cause of UTIs, and occasionally you can find parasitic organisms as well. So lower UTIs can progress up to upper UTIs, and then the further upstream the infection is, so when you get up into the upper parts of the urinary system, like the kidneys, for example, then you're reaching a point where you can actually have more complications in the patient, which can lead to things like chronic pyelonephritis, a scar tissue within the kidneys. It can also impair the kidney function, lead to renal failure, or a need for dialysis or kidney transplants if it continues to the point of causing severe damage. So UTIs are a major healthcare issue, which account for about 10 million doctors' office visits each year within the U.S. And bacteria are the leading cause of UTIs given the proximity of the urethra to the anus and genitalia. And they can also be introduced, these organisms can be introduced through medical interventions, so like urinary catheters, especially in patients that have to do self-catheterization. Then they tend to start to become colonized with bacteria due to those self-cathing, as well as indwelling catheters. Clinically, UTIs are characterized into uncomplicated UTIs as well as complicated UTIs. So with uncomplicated, this is what we typically think of as far as just someone that's going to the physician, who's otherwise healthy, no abnormalities within the urinary tract, and they just develop a UTI. Whereas your complicated UTIs tend to develop in people who've been catheterized, or these patients usually have urinary tract malformations or some sort of underlying health condition, maybe something like a neurogenic bladder, in which the bladder doesn't completely empty, which may cause residual bacteria to build up within the bladder and continue to grow and repopulate, as well as kind of live in those epithelial type cells within inside the bladder. Catheter-associated urinary tract infections account for about 1 million cases of the complicated UTIs. And these are the most common type of these is a hospital-acquired type infection, so the patient is exposed while they're in the hospital. So this could be through something like catheterization. And it is the most common cause of secondary bacteremia. Urinary catheters, of course, are used to drain fluid from the bladder, which it can go into a bag, but there's also in and out catheters as well, but this is more specifically talking about the catheters that are left in. And so this can greatly increase the risk of UTIs, and it causes about 70 to 80% of the complicated UTIs due to the urinary catheters. So with bacterial UTIs, despite the diverse agents that can cause UTIs, they all tend to induce similar symptoms. With your lower UTIs, you have a variety of symptoms to include blood or white blood cells within the urine being cloudy, having an odor to it, as well as things like abdominal pain, burning. And with your upper UTIs, they tend to kind of progress with the same symptoms, but also include things like nausea, vomiting, fever, more severe abdominal pain or back pain once it does reach the kidneys. The most commonly detected the most common way to detect a UTI is through the urine dipstick test. And so on that dipstick test that's performed, it can be performed in the lab. Also, a lot of offices will do this as a point of care type test. So with this, what we're looking for is any sort of leukocyte esterase or white blood cells, as well as things like nitrite, positive for nitrite, because there are certain bacteria that can reduce nitrate to nitrite. And there are some other things that can kind of be indicative of a UTI, but if you're looking at the urine macroscopically, so with the visual eye, you're also looking for color changes, because remember, Pseudomonas can have a pigment to it and change the color of anything that it's growing in. You're also looking for cloudiness, the presence of visible blood, mucus, white blood cells or pus, as well as that odor can be very indicative of that urine requiring some sort of culture. Enteric bacteria do cause a vast majority of the UTIs, so this would be things like Proteus, Pseudomonas, Klebsiella, and the uropathogenic E. coli. But we can also see gram-positive cocci like Staphylococcus saprophyticus, Enterococcus, Group B strep, as well as your Staph aureus. And then you can also see Leptospira. So with each of these organisms, I am providing you with a little small snapshot to kind of give you an overall idea of these organisms. So with these little snapshots, you can just kind of review the descriptions of some of these organisms. I'm not going to sit and read each of these in detail, but when you're looking at the final exam, to take the final exam, you can refer back to some of these little snapshots for details about the infection itself, as and then as far as for identification, you would be looking more of the previous modules where we actually discuss the details of the organism and how to identify it. So just these little snapshots, just use them as kind of an overview of the infection itself. So with bacterial UTIs, we're usually looking at the enteric bacteria, so those are listed here, and also the gram-positive bacteria. And then when you're looking at things like the epidemiology, this is just going to kind of give you an idea of things like risk factors, or where you typically see the infection rise from. And then we look at things like the transmission and prevention. So this is how the patient obtains the organism, and then if there's any ways to kind of help prevent the transmission of that organism. And then we look at signs and symptoms of the disease process itself, and pathogenesis and virulence factors. So if the organism itself has any special factors to it that allows it to thrive in that particular infection, or to continue to any of the virulence factors that it has that helps for it to continue to grow. And then we'll also cover a little bit of how it's diagnosed and how it's treated. So for example, like with the bacterial type infections, it's typically transmitted just as an opportunistic type infection. It could be through a sexual transmission, just from being exposed to the sexual partner's flora, as well as that close contact of the urinary and anal opening. And then as well as things like catheter association, hospital-acquired type infections. And just prevention would be just to maintain bladder health with flushing with plenty of water, keeping hydrated, good hygiene, keeping clean. With females, it's usually recommended that they urinate before and after sexual intercourse to help flush any organisms that it could have been pushed into the urethra, kind of push those out. And then with diagnosis, of course, culture would be how we would look for identifying the particular bacteria within the urinary tract infection. There could be some other test methods like doing a urine dipstick, but the culture is primarily what's going to be used. If you have complicated cases, then you might do further evaluations of looking at the kidney itself, looking for damage. And then, of course, treatment would be with antibiotics, and that would depend on the particular organism that was identified as to which antibiotic would be used to treat the infection, as well as doing those antimicrobial sensitivity testing, which would look for organisms that have developed resistance to any particular antibiotic. Then the physician could prescribe something else. So here we have the snapshot of the leptospirosis with the infectious agent being Leptospirosia. And so this is your gram-negative spirochete, and of course it comes from transmission through animal excrements, which can enter the body through various ways, being exposed to any sort of skin abrasion or mucous membranes, and then the bacteria eventually make their way through the bloodstream to the kidneys, and then the patient will exhibit UTI type symptoms, as well as things like fever, headache, vomiting, and it can progress to eventually turn into something like renal failure, liver failure, meningitis, respiratory distress. Viral UTIs are very rare in people who have a normal immune system. So these are usually seen in people who are immunocompromised. Even in these patients, viral agents only account for about 25% of the UTIs. However, they can cause, the one more specifically that we look at is the hantavirus, which can cause the hemorrhagic fever with renal syndrome. And then, of course, we also have adenovirus, cytomegalovirus, and BK virus. And so here it's just kind of divided out again with these organisms and a little bit about the infection that they cause and how they're diagnosed and treated. Fungal UTIs or Candidaria. This is from the Candida species, which is it's a yeast, and it's the most common fungus that's going to cause a UTI type infection. It causes about 7% of complicated UTIs, 1% of uncomplicated UTIs. So fungal UTIs present basically the same as the bacterial or viral UTI, and they're very common in catheterized patients and in patients with underlying medical conditions, so especially patients with diabetes. They tend to harbor yeast more abundantly than non-diabetic patients, and this is just due to several factors, including the immune system, as well as that excess sugar tends to make the Candida species kind of thrive a little bit better than it would in a non-diabetic patient. So you can see the Candida infections not only in the urinary system but throughout the body with diabetic patients. And so patients should be evaluated for any sort of underlying urological abnormalities if we do start finding the Candida infections, and just simply because they're a little bit more uncommon unless there's some sort of underlying issue. So to diagnose yeast infection, it would be basically finding the yeast in the urine and treating with the fluconazole. With your female patients, more specifically, you do have to be careful with diagnosing a urinary tract UTI versus a genitalial type of Candida infection or yeast infection because of the anatomy. Of course, doing a routine urinalysis, you could have some contamination from vaginal secretions of the yeast. So looking at our reproductive system infections, we're going to start talking about our viral infections. Many sexually transmitted pathogens do not target the reproductive system, but some of the ones that do include viral, bacterial, parasitic, and fungal infections. So with sexually transmitted infections, they can cause things like lesions or ulcers with pronounced inflammation that can lead to increased risk for transmission of things like HIV or other bloodborne sexually transmitted infections. And so the World Health Organization does estimate that the presence of ulcerative sexually transmitted infections increase the risk of HIV transmission by 10 to 50% in women and 50 to 300% in men. Genital herpes affects the reproductive system and can cause serious neonatal complications. So when we talk about genital herpes, we're talking about the herpes simplex virus 2, which can also cause neonatal herpes. And then we also see the human papillomavirus, HPV, which is the most common sexually transmitted infection worldwide. So here we have a snapshot of genital herpes, which affects the reproductive system and can cause very serious neonatal complications. So with genital herpes, this is the herpes simplex virus 2. With 1 in 6 people age 14 to 49 generally have some sort of exposure to the herpes simplex virus 2. And so it can come from unprotected oral sex, which can transmit the virus to the genital area, or as well as from the genital to the mouth. With the oral infections, you shed very few virons to be able to cause that transmission, but it is still possible. Signs and symptoms would include where this organism actually enters the epithelial cells and it causes an outbreak of things like ulcers, usually within 3 days of actual transmission. And then you can have those lesions that kind of start to expand from there. And then with a latent infection, so if it just goes on untreated, you can have these organisms kind of lay dormant, and then they'll make their way through the peripheral nerves where those lesions actually developed and then cause further issues there. And so again, having some sort of infection like this can increase your risk for exposure or risk for actually getting an HIV infection. And again, snapshot of your neonatal herpes. So again, it is caused by the herpes simplex virus 2. And these infections are usually just transmitted during delivery, or it crosses the placenta. So doing a cesarean section of a known positive patient would help prevent transmission of the herpes simplex virus from mother to infant. And HPV, of course, you hear a lot about HPV now with the increased advertisements for the HPV vaccines. And so with HPV, it is the most common sexually transmitted infection in the world. And there are a variety of subtypes of HPV. But with HPV being sexually transmitted, most people at some point do have some sort of exposure to this particular virus. And so it's been linked to causes of cervical cancer. But again, I encourage you to look at the statistics of some of the things like this. So if you're kind of, curious about things like vaccines for HPV and things like that, do some research, look up the amount of cervical cancers that happen worldwide to kind of help you make that judgment, because there are certain HPVs that are not linked to cervical cancer. So just kind of read the statistics on cervical cancer development from actual HPV viruses and look at those statistics if it's something that you're curious about, to kind of help weigh whether or not you feel like the HPV virus vaccine is actually something that is worth getting, because I know that's a question that a lot of students will have over the years, is about that HPV virus, since we're seeing this vaccine as well as other vaccines start to emerge onto the market. Bacterial infections of the reproductive system are usually caused by a variety of factors other than just sexually transmitted. And of course, what we've already mentioned is just that the microbiota of the vaginal area, the genitalia, can fluctuate due to various things and can cause that imbalance in those normal flora. So you have vaginosis and vaginitis. With vaginosis, it's an overgrowth of one type of microbacteria over another. And so this can cause, once you get that imbalance and you get that overgrowth of the other bacteria or the pathogenic type bacteria, then you can start having foul-smelling vaginal secretions or excessive secretions. So you can have things like odor, little clumps of discharge. So you have various signs. You can have color to the discharge, so this can be indicative of a vaginosis type infection. And with vaginitis, you have actual inflammation of the vagina, and this can be caused by infections or any sort of adverse reaction to various chemicals that are exposed to that vaginal wall. So with bacterial vaginosis, you have a decrease in the lactobacillus, which allows overgrowth of other bacteria. You can have chlamydia type infection. You can have a gonorrhea type infection, a pelvic inflammatory disease, which is where a lot of these infections just kind of continue on to the point of causing actual inflammation type process. And you can have a syphilis type infection, or as well as a canker type infection. With bacterial vaginosis, again, you have a decrease in that normal flora, and which can allow for overgrowth of things like Gardnerella, Bacteroides. And then once you have that overgrowth, the women will start to show symptoms with things like the color and odor of the discharge, They can have pain, inflammation in that area, and if it's a pregnant female, then the risk factors for preterm labor start to increase. And then dependent on the infection, if it goes too long, it can actually cause infertility. And so with diagnosing this, there are a few things that can be done, but typically doing some sort of wet mounts to check the pH of the vaginal discharge, or looking for the presence of clue cells, or performing a whiff test. With the whiff test, it's KOH is added to the specimen, and you're looking for the presence of like a fishy type odor, which will indicate the bacterial vaginosis. So chlamydia trachomatis has a couple of subvars that can lead to infection. So we have the disease, which we typically refer to as chlamydia, as well as the lymphogranuloma venereum. With these infections, of course, it is a gram-negative bacteria that will live inside of the actual cells, so like your epithelial cells. And then the infection kind of goes from there. So it infects one cell, and then when that cell phagocytizes and bursts open, then those organisms will kind of start to spread to other cells. So it is a sexually transmitted organism, and the disease process can vary depending on the organism. And in some patients, it can actually go undetected, or not necessarily undetected, but unsymptomatic. So the patient doesn't really know that they have it and that they could be potentially infecting other patients. And so diagnosis can be done using molecular methods as well as cultural methods. Usually if there's any sort of like STD probe that's being done, it's going to be an automated type methods for detecting this organism. And so with those STD probes, usually you're looking for multiple organisms off of that one test, or off of that one sample. Neonatal exposures due to the peritoneal exposure of the mother, the infection that the mother has being passed to the infant. So these infections include conjunctivitis and sepsis. And if it's untreated, they can actually cause the infant to become blind, can turn into arthritis in the infant, meningitis, and can even cause death in the infant. And so again, Neisseria gonorrhea is a gram-negative organism, and most of these infections are asymptomatic, but they can cause infections in both men and women, as well as complications like pelvic inflammatory disease, infertility, and again, infections like this may be hard to differentiate from something like chlamydia. So this is where those STD probes come into place, where you're testing for multiple organisms if you're suspecting some sort of sexually transmitted organism. So with pelvic inflammatory disease, of course, it's reached a point where it's kind of, the infection has actually been left untreated and has caused an adverse effect within the reproductive system. And so this is with females, of course. And with these infections, you can actually infect the fallopian tubes, and it can actually cause problems within that fallopian tube and lead to infertility and ectopic pregnancies, miscarriages. Syphilis is caused by Treponema pallidum, which is a gram-negative bacteria, and it is sexually transmitted due to exposure from to someone who actually has the infection, so being exposed to that sore where that infection is. And there are a couple of different ways that this particular infection can be diagnosed. It could be diagnosed through dark field microscopy, where you're actually looking for that spirochete, or you're looking for, which are more common ways of detecting, is the non-treponemial or the treponemial antibody testing. And so with those, you're usually going to do not just the non-treponemial, but the treponemial, to kind of confirm that that organism is present in that patient, because you do have some things that can cause false positive reactions as well. And of course, with congenital syphilis, it's when the syphilis infection is passed from mother to fetus. With a cankerid, you're looking at Haemophilus, which is a gram-negative non-nodal rod that will actually be transmitted sexually, and it will cause ulcers, genital type ulcers, which can also progress to the lymph nodes. So we also have infections that can be caused by yeast, as well as by parasitic type organisms. So our yeast infections is again caused from the Candida, and of course it is a opportunistic type organism, and it's the most common fungal infection of the reproductive system. And with Trichomonas vaginalis, this is a parasite that does have flagella on it with that undulating membrane. With candidias, of course, with the yeast infection, women typically have a vaginal itching, burning, a cottage cheese-like discharge. Men can experience an itchy rash on the genital area. And of course, when we're looking at this organism, we're looking for that budding yeast type appearance and a microscopic appearance. And so this could be done like with a wet mount or with a culture, doing an actual culture. But most of the time, the physician's going to diagnose it based on symptoms, and possibly doing like a wet mount to look for those actual yeast, those budding yeast. Trichomonas, of course, is a parasite that is sexually transmitted. And with this parasite, again, you're going to do a wet mount, and you're going to actually look for that organism to be moving in that wet mount. They don't last very long, or they're not viable. These organisms are not viable very long outside of the body. So when a physician decides that they want to look for this by doing a wet mount, that is a test that needs to be done rapidly, just so that you can see those organisms moving. Technically, if the organism is not still alive and viable, moving, we should say, we're not really supposed to call them, because it could just be a dead organism left from a treated infection. It's not an actual active infection. So usually you want to look at these specimens for like a wet mount, usually within 30 minutes. With urine, they do typically tend to die a little bit quicker, so they can be seen in urine. So again, you want to look at these as soon as possible when you're suspecting this particular type infection.